Greetings from Rome. This is Arthroscopy Journal Associate Editor Giuseppe Milano, and I'm presenting the December 2014 issue. There are several interesting papers in this month's issue. Dr. O'Brien and colleagues described an arthroscopic technique for subdeltoid transfer of the long head of the biceps tendon to the conjoint tendon in 54 patients with chronic refractory bicep tendonitis. At more than 6 years postoperatively, results were good to excellent in 88% of patients. This paper contains an excellent video which illustrates the surgical technique. Dr. Shasha and colleagues performed a prospective cohort study to identify patient variables that would be predictive of failure of rehabilitation in the treatment of slap lesion symptoms and dysfunction. The study, conducted on 58 patients, showed that upon initial evaluation, the presence of a painful arc of overhead motion indicating loss of normal glenohumeral kinematics and forward shoulder posture indicating altered scapular position represent negative predictive factors for success of rehabilitation. Dr. Frank and colleagues analyzed the clinical and radiographic outcomes following revision meniscal allograft transplantation on 11 patients who were evaluated preoperatively and annually for a minimum of 2-year follow-up. Results showed high patient satisfaction and significant symptom reduction on validated outcome scores such as IKDC and KOOS pain. Radiographic grading did not demonstrate progression of osteoarthritis. Only one patient progressed to arthroplasty during follow-up. Dr. Kaya and colleagues performed a case control study to investigate the association between ligamentous teres injury and hip joint cartilage damage pattern in patients with femoral acetabular impingement. Data collected from 77 consecutive patients who underwent hip arthroscopy for femoral acetabular impingement confirmed the association between ligamentous teres injury and articular cartilage damage in the inferior middle part of the acetabulum and the apex of the femoral head. There are several biomechanical studies on shoulder in this month's issue. Dr. Chan and colleagues evaluated the effect of the location of biceps tenotomy and the integrity of the superior labrum on superior glenohumeral stability. Dr. Daskin and colleagues performed a cadaver study to assess if a single row suture anchor repair of a bony Bankart lesion restores peak translational force and glenoid depth. The authors showed that repair of a bone defect equivalent to 19% of glenoid length with 3 suture anchors failed to restore natural glenoid depth. Dr. Green and colleagues contributed to the debate regarding the optimum insertion angle of suture anchors in rotator cuff repair. The authors investigated the effect of insertion angle and angle of applied load on the pull-out strength of screw-in suture anchors and found that anchor pull-out strength is highest when the direction of load is applied in a parallel or nearly parallel vector to the anchor. 2 systematic literature reviews are focused on hip arthroscopy. Dr. Yang and colleagues analyzed the global trend of surgical management of femoral acetabular impingement. The surgical interventions, gender distribution, outcome measures, and diagnostic imaging utilized were compared between geographical regions. Dr. Ayeni and colleagues analyzed indications, treatments, and surgical outcomes for management of ligamentum teres injuries. 2 more systematic reviews investigated the results of reconstruction procedures for the treatment of bone loss in shoulder instability. Dr. Sayer and colleagues performed a systematic review of level 4 studies that reported clinical or radiographical outcomes after allograft reconstruction for glenoid bone deficiency. Dr. Longo and colleagues analyzed the body of literature on the efficacy of different surgical procedures for the treatment of anterior or posterior shoulder instability associated to humeral bone loss. Thank you, and I hope you enjoy reading these and many other interesting articles in the December 2014 issue of the Arthroscopy Journal.